Hey, nerve problems that start from birth that carry on through the toddler years and into child years, they do not remain quiet. They will change and evolve just as your child changes and evolves as well. So just remember, subluxations, misalignments, fixations with that spine that cause the nervous system not to communicate properly with the brain and the body. And it actually happens in stages. First, the baby will tend to go into fight and flight, where they're sympathetic, their nervous system that really speeds their body up is always on. After a period of time, the nervous system starts to actually scramble or rewire the brain, especially if there's no movement involved, to program that brain to work properly and to perceive the environment properly. So babies that used to have colic, then meltdowns, now start to have kids that show up as anxiety or ADHD or other neurodivergent issues that are more severe, or non-verbalization effects as well. Chronic ear infections that used to be, filled with ear tubes or antibiotics, now they're changing into chronic breathing problems and immune system problems with the breathing, asthma that starts to have an effect as well. Poor coordination leads to poor development and poor learning, especially as your child gets into the school years where I can't focus, it's hard to sit still because their nervous system just can't perceive that information the way it's programmed and designed to do. So symptoms will evolve, the subluxations, they remain the same. And over a period of time, it'll start to scramble the interaction between the brain and your child's body. So why do I do this? Why do I ask questions about pregnancy? Why do I ask questions about birth? And why do I ask questions about life stresses along the way, whether it be colic or stays in the NICU? Because all those will start to build a nervous system that start to get super stressed and eventually starts to become super scrambled. So nervous system is the key, because that's what allows your body to function the way it's programmed to function. And if your child's nervous system is not functioning correctly, well, it's not going to get set up correctly in those first few crucial years that lead to problems when your child is in school and when there is structure, and then have those social interactions as well. Now, MDs, they're not designed to look at this. They're designed to say, this is the symptom. How do we take care of the symptom? How do we take care of what's expressing? But let's dive deeper into the way the body is functioning. Their answer is chemistry, or even maybe some therapies that address, hey, if body isn't moving, or if the arm isn't moving, we just need to move it more and get it moving more. Well, we have to ask the question, why isn't the arm moving to begin with? Or, hey, if the child's not developing, it's just we need to develop them more. We need to put more books in front of them. We need to set more. Well, if that's not the case, we have to ask the question, why isn't my child able to set more or able to focus as well? I hope this makes sense from you. This is your child's story. Give us a call. We're prepared to help you in any way we can. Until then, God bless.